She was an avid golfer and she wasn't able to walk the course. She would have to ride the cart, which she didn't enjoy. And walking the course is part of the game. If you can't walk it, you can't see it, you can't really play. So it's that ability or the need to be able to walk is what really propagated Sister Lorraine to seek further treatment.
It was a pain that wasn't alleviated very easily. So I came to see Dr. Tekmyster and we talked. Therapy for this situation would be longer than I wanted to wait in one aspect. And secondly, there was no guarantee that therapy was going to do anything for it. We agreed that the operation would be the best thing.
The recovery from a Superion procedure is fairly quick. You go home the same day, stitches stay in for a week, but you're free to resume sort of normal, limited daily activities even the next day. The device is implanted into the spine and it stays there, allowing continued pain relief. And as of now, Superion is the only device of its kind that allows us to do that. It is done in an outpatient setting without having to expose the patient to a hospital where there's a risk of infections. It takes about a half hour to 45 minutes to do, and you go home the same day. There's really minimal recovery. You're free to drive the next day. You come back a week later to take the stitches out, and people go back to playing golf within 3 or 4 weeks. Certainly some limitations initially with bending and lifting, but the recovery, because the surgery is so much less invasive, is also much quicker than traditional therapies have been in the past.
I feel like at least, or maybe a little more than 75% better than I was before the operation, and after I was able to play a little golf without too much stress. I have told people about what happened, what I experienced, and I think my cousin is now coming to Dr. Tekmyster for whatever her problems are.